Cases continue to explode in Italy and in South Korea. It looks like we've reached a tipping point of awareness. And some countries probably fibbing about their numbers. Hello, everyone. I'm Chris Martinson. I'm here today on February 24th, 2020 with your COVID-19 update, your coronavirus update. I'm titling this one, Are You Prepared? Let's go to the numbers. Again, we got numbers from China. Yep, that's about all we got. We don't know what they really mean, and China is doing everything it can to put a good face in this and show that they are past this particular coronavirus incident as best they can. They want people to get back to work. We're going to talk about that because it's really important. A lot of countries are going to have to make that same decision soon. It's not an easy one, but South Korea, wow, vaulting right up here, 231 new cases. Notice here 8 total deaths, and this comes into play when we look at where we are in Iran with 12 total deaths. There is just no way that Iran with 12 deaths has only 47 cases. And there's a bit of a kerfuffle in Iran about how many cases they have, how many deaths they have. The deaths may be as high as 50. We don't know. But they're also reporting nobody serious. So these numbers, completely suspect and absolutely not correct at this point in time. Everything's higher. And that much we can say for sure, but we don't know how much. The disaster princess, this is pretty much over now. Everybody's been sort of taken off and repatriated. The total cases got logged on there. It's going to be stuck there for a while, but we are seeing in the United States, these plus 18 that showed up in the United States were people who were flown back and got infected on the plane ride back, or were just asymptomatic and arrived and became symptomatic. But one way or the other, they showed up and became infected here in the United States. Italy, another 66 cases coming to 223. More deaths again of elderly people mainly. Total deaths now 6. And I think that's actually come up since we've seen that. But look at this one. This Thailand still at 35. These numbers have just been frozen in ice for a week or more now. I don't believe these, not for a second. And I don't believe these Vietnam numbers either, sharing that huge border with China, knowing that they had put a 10,000 person community into quarantine. Not a peep since. I'm not buying any of it. In fact, here, you have to read through and look at your clues. The UAE banned citizens traveling to Iran and Thailand to prevent the spread of coronavirus. The foreign ministry says, why Thailand? I thought we just said Thailand doesn't have a problem. They haven't had a new case reported in weeks. But here you have a country saying, and a pretty sophisticated country saying, you know what, don't go to Iran where we know there's a raging outbreak, or Thailand. So I'm going to take my clues from that and say Thailand's just not being on the up and up about their particular case set. Italy, look at this case progression. Day by day, one day later, well, that's a 5-fold increase. That's about a 3-fold increase that next day. Here, at least a little bit more than a 2x increase. Probably aiming for a 2x increase today. The day is still in progress. Italy's working very hard to get these numbers under control and put full containment in. And they've got a good medical system, so I would not be surprised if they get their arms around this. But it just shows how explosively virulent and this particular coronavirus actually is. And yeah, here, Italy reports another death from coronavirus, raising the toll to 7. The latest patient, 62, kind of on the young side for deaths. So it just, whatever marched into Italy, and I would love to see that it's been sequenced and it's exactly the same thing as the strains that were in China, because this all feels just a little bit more virulent than I would have expected, or China's really downplayed their results more than I thought. In Iran now has shut schools, it's shut universities, cultural centers, all kinds of things, all within a fairly substantial region inside of Iran. Again, this does not comport well with the idea that they have just a handful of cases. That doesn't fit at all. And Iran is now denying that it's covered up 6 deaths as reported. Denies a cover-up as 6 deaths are reported in Italy. Tehran rejects the claim that the death toll is more than 4 times higher than official figures suggest. It could be 4, it could be 12. We don't really know. But this is just another country that prefers to be less than forthcoming with the data. I don't know, because it's embarrassing, because they don't want to scare their people, because it's, I don't know what. But there are countries that take that route, and then there are countries like South Korea that go the other direction and are very, very open, very transparent about what they're up to. So as we saw yesterday, we had all these cases exploding out, and now, this is where we were, February 23rd. 22nd at 436 cases, and now in Korea, well over 800 here. So that's just gone really out of control there. And good luck to South Korea getting their arms around that. In the United States, so the CDC reportedly opposed the State Department's decision to allow 14 individuals who were confirmed to be infected to travel on the evac flight after their cases were confirmed just before takeoff, thanks to one of the many botched drop-the-ball moments attributed to Japanese health officials, or bureaucrats in many cases. So whose lot of fingers being pointed here? Was it the Japanese health officials that botched this? Was it the State Department overriding the CDC? It was a State Department flight, so this is on the State Department. They made the decision, you know what, let's take everybody, let's put them on this plane. Somebody made that decision. I doubt it was the State Department. I bet somebody who made that decision has a name. That would be interesting to find out, I think. And this is exactly what they were warned about. In addition to the 14 people who were already infected, it appears another 25 were infected on the flight back, where sick individuals were separated by the rest using duct tape and a thin tarp-like sheet. I thought when they were going to evac those people that they had some kind of I thought it wasn't rinky-dink. I thought they would have had some sort of an isolation chamber in the back or some way of isolating those two cohorts of people, populations from each other, but apparently not. Apparently duct tape. I'm going to have to rethink my own preparations here because I have duct tape's part of mine, but I'm not trying to fly 14 infected people around with a whole plane load of other folks. So that's really not good news right there. That's a botched moment as well. And China, Here's China. China has 6 provinces are lowering their coronavirus emergency response level. As of late this morning, Guangdong, Shanxi lowered response to level 2. And these other ones here all lowered it to level 3. So China's saying, time to get back in the pool. We'd like people to go back to work. We're lowering the response levels here. Don't worry about it. Also, China postpones the National People's Congress, which is their biggest and most important bureaucratic meeting and political meeting of the year. And so they postponed it. It's been a long time since anything like that happened. So you got China saying, don't worry, everything's back in the pool. But for the important people, if I can phrase it that way, who make the decisions and run the country, they're like, you know what? We'd rather not gather. Everybody else can gather. I don't think we're ready to gather. I always trust what people do more than what they say. And that's just how we roll. All right, you know what? It's been a month since I first started tracking this thing. I was getting pieces of information that were starting to float across my normal information tracking routine. Back in around January 20th is where it really started to pop up, and I started looking at it. By Wednesday night, I realized I had to write something, and so this came out on Thursday morning on January 23rd. That's now a month and a day ago, 6 in the morning. And I just had to get this out, and so we made this alert public for everybody, because normally these alerts are issued. I only issue them when events cause me to take personal action. So if I feel like I got to run down to Costco and get some more toilet paper because I'm worried we're about to get to the self-evident stage, I'll send out an alert to people. So that's what I did. But I made this one public because it was just too important, and I didn't want to this felt like I had to get it out to everybody. And so here's what I wrote back then. You can go and find the entire article here. I stand by every word. Got it really, really right, considering how much data we had to go on at that point in time. So I wrote, the coronavirus is currently sweeping across China. So far, it has all the hallmarks of a potential true pandemic outbreak. Those just how it appeared to me based on everything I could find out virologically about it and from what the data was saying, and also how China was reacting. Those pieces together made me write it that way. And while it could still and hopefully will be contained and burn itself out, the chances of that are slipping by the hour. And of course, they slip every single time you do something like flying infected people with uninfected people. These botched things, you don't get many botched efforts when it comes to a pandemic like this. You got to get it right. If any actual pandemic breaks out, expect the following to happen quickly. Travel within and especially between the countries will be restricted, if not completely banned. Critical shortages of materials will develop, especially medical supplies, doubly especially antivirals. In cities with lockdowns or quarantines, food will disappear rapidly from shelves. So check. Listen, I'm not here to toot my horn and say, hey, I managed to get something right. What happened here is this is just what happens when you use logic and science and you're not constrained by political boundaries of saying things that are not politically correct or not within the Overton window or might upset your boss because it hasn't been cleared from the PR department. This is the value of just applying good, solid logic, especially during a fast-moving situation. Of course, I did give a pro tip out way back then that people might want to think about getting face masks. And of course, always don't be a hoarder. Buy only what you really need. The time to responsibly stock up was actually before now. And that's always been part of our message. But now that we've got here and this month has passed and we've hit this little tipping point, the markets have finally started to melt down. This is just a screen grab from just a few minutes ago. We see the S&P and the Dow down, big amounts. Oil is down, of course, because oil is used heavily in economic processes. So when you see oil and copper down, what this is really saying between these two plus all of these other ones up here, but these two in particular are saying the economy is really getting tanked here because you use a lot of copper in the economy, use a lot of oil in the economy. And I've been reading reports from people who say that the air in Hong Kong, in Beijing, is as clear as it's ever been in decades. You can see the stars at night again. It's just a measure of how much oil isn't being burned, how much coal isn't being burned, how much natural gas isn't being used, because their economy is really very much in a full lockdown. Gold and silver, of course, doing reasonably well in an environment like this because, well, those tend to hedge against systemic problems and financial system problems, and there's going to be a lot of financial system problems with this, so that makes sense. So let's talk a little bit about that idea that China is trying to get its people back to work. I get it. I'm totally sensitive to the idea, and there's a really tricky balancing act that every country that now has this particular disease is going to have to struggle with. And here's that balancing act. Number one, if you want to contain this thing and you want it to stop spreading, you got to get the R naught below 1, meaning on average, somebody who's got the disease during their infective period, which, by the way, could be before, during, and after the symptoms, right? You need to keep people isolated and contained to prevent the spread. And that is what you got to do to help get the R naught below 1. So that's part one. Great. If that was our only thing we had to balance, not a problem. We'll just lock everybody up. We'll bring food to the door, and that'll be great. Unfortunately, there's this other balancing act, which is you kind of need to keep the economy going, at least enough to feed everyone for sure, maybe keep them warm, all kinds of things. Critical things have to happen to keep the economy going. But there's the balancing act, because if people are contained, they're not over here working. But if they're over here working, then there's a chance that this thing isn't going to be isolated and contained, which brings us to the third piece in this balancing act, which is you need to keep the infection rate below the level that swamps the hospitals. So way over here, if everybody's contained and you've got good functioning hospitals, case fatality rate, I don't know, it might be as low as 1% once we add up everybody who's got the disease, including the people who didn't even know they had it. Who were asymptomatic the whole way through, including the people who had mild illnesses. We don't know. But over here, you have about, let's call it between 1 and 3% case fatality rate. But if you swamp your hospitals, now you have a case fatality rate that might spike to 18%. And this is very, very bad. So you have to balance across all three of these. Contain people as much as you can. China thinks they've got that and they've cracked the nut on that, and that their numbers are leveling off, which I believe they are. And now they're saying we want to get people over here, but they have to do it at a rate that doesn't make this come back into being. And looking at how quickly this is all exploding in Italy, China isn't out of the woods. It's not like they've got herd immunity now. It's not like enough people have gotten it. If we take their numbers at face value, there are, 11 million people in the city of Wuhan, and they've only admitted to maybe 78,000 cases now across the entire country. So that's a fraction of a percent of the people who might be within the area where it's now endemic. So no fire breaks there yet. You would need to have, I don't know, maybe 60, 70% of the people would have had to have been exposed to give you a fire break effect. So they got a bunch of people hiding out from the disease who, if they come back out into public over here, they're going to get the disease. And if too many of them get it, they end up over here. So what's the right number, and how do you begin to manage all of that? That's the balancing act, and that's what every country that gets this is going to have to figure out how to balance. In other news, oh my God, I put this one under, I don't even know what to say. What are you going to say, right? The WHO says it's no longer going to use pandemic category. The virus, it's still an emergency, but we're just not going to say pandemic anymore. So it no longer uses the term pandemic. I guess because, I don't know, that they ran a focus study group and people didn't like that word and made them unhappy. I don't know what's going on here, but who is spending all this time wordsmithing? Here's a wordsmith, COVID-19. They had to wordsmith that so that nobody's offended by it. And now they're not going to use pandemic, and they're doing all of this. But what they're not doing is providing really excellent, timely, useful information. So remember, you can't have a pandemic if you don't call it that. That's pretty smart. That's pretty smart. Way back on that first article that I told you about that I wrote back in January 23rd, I had put out the WHO Pandemic Guidelines, and I was crossing off the phases as we got there. By the way, we can cross out phase 4 because we've got there, which was human-to-human transmission, which we certainly have. Able to sustain community-level outbreaks has been verified. Absolutely. Phase 5. The same identified viruses cause sustained community-level outbreaks in 2 or more countries. Yep, that's passed. In addition to the criteria in Phase 5, the same virus has caused sustained community-level outbreaks in at least one other country in another WHO region. Yep. So I think once we ticked off Phase 6 with Italy and Iran getting on board there, that's when the full pandemic, you couldn't avoid calling it a pandemic anymore. So the WHO said, you know what? We're not using that term anymore. So at any rate, they had to drop it because we have a pandemic. All right. Once again, though, I got to turn away. Singapore is absolutely leading the way. So remember yesterday we said that they had no new cases. They have a case today. It's I think one more case today. Let's go back to the numbers real quick. Yeah, one more case today. That's fine. All right, so they really have their arms around this. And so I wanted to talk about this paper that came out on February 20th here, and it's in the JAMAnetwork.com journals. Here's the URL for this. And they're talking about their current experience here, and there was some really interesting information in here that made me jealous as an American. I wish my health authorities were like this. So look how Singapore reacted to this. This is really important to check out. Singapore promptly shifted its public health response level to enhance preparedness in its diagnosis first case, a tourist from Wuhan on January 23rd. Okay? So all the way back there, the range of public health measures that were instituted and rapidly escalated right there on that spot with the first case, right, included aggressive contact tracing, quarantine of close contacts of confirmed cases, namely persons who had spent a prolonged period within 2 meters of a confirmed case. Look at how defined that is. A prolonged period, maybe they could sharpen that up for me a little bit, but were you within 6 feet or so of this person? How long? Boom, you're quarantined. They put out travel advisories right away and then entry restrictions on people traveling from Hubei. And on January 31st, so that's 8 days later, entry restrictions on people who had traveled to China in the preceding 14 days. Approximately 700 recent travelers from Hubei were quarantined, and Singaporeans, permanent residents, long-term visa holders returning from China were placed under a 14-day compulsory leave of absence from work. That's what it looks like and feels like when you've got people who are on the ball. No Singapore health officials are going to be putting 14 infected people on the back of a plane and putting some tape and a piece of sheeting up. Okay, it's not how they roll, right? The approach taken by Singapore, learning from its experience with SARS. So they learned from it. Didn't just happen and they forgot about it and promised they'd do something later and never did, right? Is that all confirmed cases are isolated until 2 consecutive respiratory samples become negative over 2 days. Close contacts are identified, and those individuals without symptoms are quarantined for 14 days from last exposure. As of February 19th, a total of 2,593 close contacts have been identified. Of these, 1,172 are currently quarantined, 1,421 have completed their quarantine. Contacts with symptoms are tested for COVID-19. That's how they roll, right? Aggressive contact tracing. That's what you do. And as well, they're also testing very aggressively. So let me make sure I spell this correctly up here because I like to do that. here, the second, and continuing on with this paper, the early presentation of COVID-19 infection is typically nonspecific. Oh, they presented to primary care clinics with common and mild symptoms, dry cough, a sore throat, a low-grade fever, a little malaise, before worsening of symptoms several days later triggered attendance at hospital emergency departments. So they got the progression down here. Because acute respiratory infections are very common, there's a pressing requirement for a rapid, sensitive, affordable point-of-care screening test, not ship it off to Atlanta so the CDC can test it for you from across the country. A point-of-care screening test in the primary care setting to identify suspected cases as early as possible to reduce community spread. It's critical that clinicians take a detailed travel and exposure history during this epidemic. Boom! That's how you do it. It's amazing. Let's contrast that with Canada. Here's a person from Canada. I just found this morning. He says, my chest x-rays came back. Here they are. Ooh, that doesn't look good. Look what's going on right there, right? In that lower left lobe, there's a bit of pneumonia there. Right is healthy. Left is now with pneumonia. I have all symptoms, fever, cough, shortness of breath. I work with a lot of Asians. They won't test for COVID, even though doctor said I had viral symptoms. Reposted because my first symptom, anyway, didn't need to read that part. So here's a person, they're presenting, they're going to their doctor. This is in Canada. They said here, guys, the fun is over for me. I'm terrified. I don't know what to do. I called a medical advice line. They are saying the same thing. No travel, no close contact with anyone means no testing, right? And as we saw yesterday, the CDC won't test unless you personally have been to China, right? Or had traveled to China, or you had been exposed to somebody who was known to have COVID-19, right? So, and then let's just contrast that with South Korea. 11,631 people in South Korea are currently being tested for coronavirus, up from 8,725 this morning. More than 20,000 have already been tested, right? That's what you do because why? Well, this thing's asymptomatic because, it's got, this is just what you do. That's what you do. All right, let's contrast that with the United States. How's the United States doing? Because, Nancy Messonnier out of the CDC, the director there has been constantly saying we don't have community level outbreaks here. And that's good news. So that's really good news in the United States. Is that true? This is from the CDC website just this morning. And look, they're being very transparent with their data. And we find out that the total tested in the United States is 414 total so far. 414 people tested. Hey, good news. We only have 14 confirmed cases. I bet there's a ratio number going on here. I bet there's some sort of relationship there. 414, that's not even the last three digits in this particular number. This is what you need to do if you have any interest in finding it and detecting it. That's exactly what you do. All right. So it's kind of like they're not even trying here at this point. So this came out a couple days ago. U.S. prepares for coronavirus pandemic, school and business closures, health officials say. So the United States has yet to see community spread of the virus. Well, that's so reassuring until you understand what's going on here with this data. All right, I won't be annoyed anymore. It bothers me as a scientist. In coming weeks, if the virus begins to spread through U.S. communities, health authorities want to be ready to adopt school and business closures like those undertaken in Asian countries to contain the disease. Here's this person, Nancy Messonnier here. We're not seeing community spread here in the United States yet, but it's very possible. You have to read all the way, there's a little gray spot here, because you read all the way down this entire long article, and you find the last paragraph says only 3 U.S. states currently have the capacity to run tests for the virus locally. So remember, Singapore said it's critical, that you take these travel histories and do all of that. And as well, it's really, really important that people have the ability to do on-the-spot testing for these things. All right. Because of this, I'm reasonably certain, that, the United States is going to have its time in the sun with this particular disease. It's here. 390,000 Asian students return in the United States from mainland China. Many of them go back and forth. It's unlikely that if even 100,000 of them went back for holidays and came back, that only 14 total people managed to be infected with that. Remember, prepare early, prepare often. This is Daegu, Korea at the moment. People here lining up for groceries, right? So day one, the day before this line happened, there was no grocery line whatsoever. And today there is, right? That's just how these things tend to go. All right. Guess what? This is not the flu. It's not SARS. I don't have anything brand new to add to all of this. The only thing I would begin to add would be how important it is that your health officials are communicating openly, transparently, giving you all the data, letting you know what you need to know so that you can be a part of the solution rather than treating us out here as if we were cattle or something that, they'll tell us when we need to know. But the truth is everybody ought to be engaging in proper hand washing and sanitation, learning how to stop touching our faces, learning that once we touch a public surface like a doorknob or a railing that our hands are now infected and possibly infective, and learning that we need to be really conscious if we do have any sort of coughs, sniffles, anything like that, to be the ones wearing the face masks so that we don't infect others, or to self-isolate, or both, right? That's all good stuff. All right, conclusions for today. Some countries definitely hiding their true numbers. No question about that. Thailand, Iran, pick a few others. I'm sure that's the case. The U.S. CDC, I don't know what they're up to, but they aren't even really trying. 414 test kits run so far. That's insufficient, given that we're facing the largest and most deadly pandemic in the past 100 years. 414 cases. I would expect that for my town, and I live in a small town. Singapore, South Korea, they continue to lead the way in terms of how you would go about actually preparing for something like this in advance. Singapore did great stuff in advance, setting after SARS, and that was only a few tens of deaths in their country, but what they learned from that was they need isolation facilities, they stockpiled masks, gowns, all the basic antivirals. They actually, one of the reasons they're able to respond so aggressively here is that they had taken the SARS experience and used it to really go forward and up their preparation. So that's part of the reason that they're doing so well here. Iran and Italy have put a big dent in my theory. Maybe not just my theory. I know other people had this too. That COVID-19 was somehow ethnically selective, that somehow Asians were more predisposed towards it. And I was thinking that for a while because, we saw the 12 people get it in Germany, and they all said they got over it pretty quick, and it was kind of like having the cold, and the cases didn't really seem to grab hold outside of China or other Asian countries. So that was a theory for a while. That just got the carpet completely pulled out from under its feet because we have Iran going through a very large outbreak right now, virulent outbreak, and we have Italy going through a very large virulent outbreak. So Persians and European stock, both now, so much for that theory. Just toss that one in the dumpster. The markets are only just now beginning to understand how serious this all is. There's going to be lots of printing by the central banks, but you can't print your way out of a supply chain nightmare. It just doesn't work. All of this really means that you really, 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 really ought to be preparing for this. And I know many of you are, and I'm gratified to have found out how many of you started to prepare as a consequence of running across these videos earlier. Please come by peakprosperity.com, where we have just a ton of material over there about how to prepare all out in the public space that you can access. And then we do have some places, things that we can't talk about in public because, I've already had hatchet articles written about me in Mother Jones. Ironic, because they were supposed to be about citizen journalism, at least how they started. So I guess they've strayed from their mission. Bloomberg, got my wiki page taken down. Of course, all of these videos have been demonetized by the Goog, and all of that. So these are all just measuring a little bit of shadow banning at Twitter. So there are things that I can't talk about in public because they're very speculative. It's very fast moving. I can't point to 10 sources and say, here's why I think that. And people are able to have a little bit more of a free-form conversation. So that does happen behind our paywall. And there's a reason for that, though. And that's for my safety and it's for the safety of the other people back there. And that's why that exists. Otherwise, come on by and, we'll help you out as best we can with all of your preparations. Because, gosh, this touches so many things and it's impossible to be perfectly prepared for something like this. All right. Thank you for listening. Talk to you tomorrow.
Hi, folks. Adam Taggart here. Chris Martinson and I are the co-founders of Peak Prosperity. If you want to get alerted whenever we release a new video from Chris, just click the red subscribe button right beneath the YouTube video player. Once you've done that, a little bell icon will appear right next to it. Click on that bell. It looks like this. And that's it. The next time we publish a video from Chris, you'll immediately receive a notification from YouTube. Thanks for watching our videos.